Yeah, it says it's already live streaming right now, by the way.
Hello, everyone, and welcome to Healthy Cooking with Shayda. I'm your host, and this is where today we have a really special guest for you. But before we get started, if you have not subscribed to our YouTube channel, please consider doing so, and please make sure to share this video. And also, if you have questions today for our guest.
Yeah, it says it's already live streaming right now, by the way.
Yeah, we're live. We're live, Nathan. We're live. And so if you guys want to ask questions, make sure to add 3 question marks at the beginning of your question, ask your question, and then end it with 3 question marks. That'll just make it really easy for Aaron to find us so we can go ahead and ask the questions. Well, our special guest today is Dr. Nathan Gershfeld, and I'd like to welcome him. He is the founder of Fasting Escape. I've had the great pleasure of teaching cooking classes at his beautiful retreat. But Nathan, you've recently made changes to Fasting Escape, which now allows you to fast in the comfort of your home under medical supervision. And I can't wait to hear all about it. So please help me, everyone, to welcome Dr. Nathan Gershfeld of Fasting Escape.
Thanks so much, Shayda. It's great to be here. And yeah, I was just before we went on live, I was telling Shayda how much Shayda invited me over to make some food I think earlier last year, and I made some Persian food and it was delicious. So, and all of our patients, when I was doing Fasting Escape, which was the physical location, we would often have Shayda whenever, I thought it was cruel and unusual punishment to have Shayda come in when people were fasting. Yeah, even though sometimes people didn't mind, but when people were not fasting, they would oftentimes request Shayda to come in and do cooking demos so they can see what it was like and how they could, get some recipes and get some ideas for making some food when they were done fasting and they were ready to go back home.
Those were some good times, and you had the most beautiful house and the most beautiful kitchen that anyone would love to be cooking in there. So it was fantastic.
I got very lucky with that house, but like many things, so that house I did not own, I leased it, and so when the lease was expired, then we moved on. But really, there were some changes happening to Fasting Escape during the pandemic, and as many people know who came and fasted there, we had plenty of people coming in during the pandemic, but there was also people who were calling me and telling me that they needed to fast because the pandemic had gotten them out of balance in many ways. Some people either had caught COVID and had caught some what we suspect now are long-term COVID symptoms. They had caught COVID and maybe gotten off balance with their diet. Maybe they had flared up some autoimmune condition with various treatments that they had tried. And so whatever the case was, or they were just out of balance and needed to come fast during the time of the pandemic. But the problem was during all the lockdowns, people who were either they were nervous about traveling, they didn't want to be exposed to the virus, or they were locked in their own country, like for Canada and other countries. So they had some trouble getting out to do some fasting. And plus, I was pretty busy, so it was
you were always busy, from what I remember.
Yeah, I mean, in particular during the pandemic, because there was so much remote work happening, people were finally able to come and do fasting, and they could work from the actual clinic. And so people wanted to fast, and they needed to wait 3, 4, 5, 6 months at some cases. People asked me if I could start helping them do a fast from the comfort of their home, and at first I was a little bit resistant because I didn't know how that would work. I was kind of, didn't know how I could control their environment like we did. We joked around at True North, Dr. Goldhamer would say we lock people up in jail and we help them do it. So I was a little bit nervous about that. But I tried it a few times and found a good little system to help people do this process through the comfort of their own home. So we started doing that a little bit more.
Very nice. Well, if you're inclined, we are going to start asking a few
Sure.
questions.
Yeah.
You started out as an electrical engineer, but you had a life-changing experience that changed the course of your life. Can you please talk a little bit about it?
Oh, sure. And so this was my experience with health. I didn't know anything about health other than, what I had casually heard on TV. So essentially next to nothing. But what I did have was a grandmother who was very into health. She was a chiropractor. She had learned about natural hygiene, and she had learned about different ways of getting healthy, and particularly diet, exercise. She was really into herbs and cleanses and these types of things.
That's wonderful.
Yeah, I think you met her a couple of times.
I met her once, and she was
Yeah.
a wonderful lady.
Yeah. And so I had, when I was in engineering school, my mom saw that I had like a lump in my neck, and it stuck. I don't know if people can see, it stuck out like this. And I didn't know what it was. I just assumed it was, I was laying like, I was sitting like this and had some muscle cramp or whatever it was. I had no clue really. So I went to the doctor, and they said, well, it's a tumor and we got to take it out, and it could be cancer. We're not really sure. But in any case, we'll take it out. So that kind of scared me. I didn't want to take anything out of my body. And they also found an autoimmune disease called Hashimoto's and hypothyroidism. And so my grandmother said, well, you've got to change up your diet. And also you have to go do some fasting. So I found out about True North, went, did some water fasting. Essentially the tumor shrank by like 80%. We could done regular ultrasounds on it. And then the autoimmune disease went away. And so did the hypothyroidism. And that kind of propelled me into a different lifestyle. And I got so interested in it that when I graduated with an electrical engineering degree, I decided that the next best thing was to go learn more about this weird technique of water fasting and help people in the same path do it themselves.
That's wonderful. I met you at True North, if I remember. You were interning at the time when I was there.
Yeah, you were there, I believe, with Chef AJ, and
right.
And I remember thinking, gosh, there's a whole community dedicated to eating like this, and really,
absolutely. So did you find it kind of hard when you were up there? Like, did you think Dr. Goldhamer was crazy with what he was doing and the way of eating, or did you adapt to it rather quickly?
No, it made perfect sense to me.
Oh, that's wonderful. You just had that knowledge that, nope, this is it. This is what I'm going to do.
Yeah, I remember I didn't know too much. I mean, there was a lot of confusion in my mind because one of the first books my grandmother gave me was about raw food. So I thought it was raw vegan this, and everything was about raw veganism, and that the ideal diet would be something with raw. I just never seen it in practice before. So I had gone to different clinics or different programs and read more about them, but I didn't really see it in practice. And so when I got to True North and I saw, gosh, you know what? They're actually showing people what to eat for breakfast, lunch, and dinner, and all their doctors, all their staff are doing this. Then it made a lot of sense to me. And then when I saw patients as a intern, I saw them improving, and I thought, gosh, okay, so not only are they living this lifestyle, and they're recommending a lifestyle, but it's actually working for people.
And you saw the results that were happening. So at firsthand. So is this how Fasting Escape basically came about?
Well, the goal that I had when I walked into True North, at the time it was called Center for Conservative Therapy. So not quite of a sexy name. But I walked in as a patient, and I thought, gosh, wouldn't it be cool if I could help people like this and help people turn their lives around and show them what needs to be done? And when I had talked to Dr. Goldhamer after I'd stayed there, he said, we really don't do internships unless you've got a chiropractic degree and unless you've got some sort of medical training. So I decided to go to chiropractic school, and I called him up about 3 weeks before my semester started. And I said, I stayed there as a patient. You told me this. I want to go. I want to learn how to do what you're doing. I want to learn how to run a center. Can I come and volunteer? And he said, wait till you're done with school. And I don't know what I said, but I talked him into it. I just said,
good for you.
Wash your shoes, or wash your dishes, shine your shoes, clean your toilets, and I'll keep my mouth shut and my eyes and ears open if you just let me come and watch. And he let me do that. I'm grateful to him for letting me learn about this type of way of healing. And so I came in there as my first. It was kind of an internship because I didn't have any training. I was just following the doctors and the interns around and just helping them with whatever they could run. Somebody needs to get a juice, so I'll go get a juice. Somebody needs to do this. It was all non-medical. So Dr. Goldhamer was extremely careful. He cares a great deal about his patients. He doesn't want, so he made sure that I wasn't in charge of anything until I got some training. And then I remember my third or fourth time. So I started going there during my school breaks. So we would do a semester and then we'd have a week or two off. So I'd call Dr. Goldhamer, drive up there, continued, following them around and learned more and more as time went on, and sat in on the doctor's consults. And then eventually Dr. Clapper came on board. And so I was sitting in with Dr. Sultana and Dr. Clapper. And then eventually Dr. Goldhamer said, what are you doing when you're done with school? And can we get you on staff here? So I agreed. It was great. I learned a heck of a lot. The whole idea was to, that we talked as he's became my mentor essentially. Sure. Is to teach me how to run and how to supervise patients myself. And when that time came, about 3 years later, after I had graduated, then it was time to start my own center in Southern California. And then, so I came down here, got my feet wet a little bit with my practice, and then started my center.
Well, I tell you, people were always asking me, is there a fasting retreat in Orange County? And I said, yep, fasting escape. And
Now
I
there was,
recommend as many of you. It's wonderful to have, to have had you here. So that's fantastic.
Yeah, it was a lot of fun.
It sure was. So can you tell us about the recent changes? And I know you touched on it a little bit about the recent changes that you've made to fasting escape, and how does all that working? I mean, for people to be doing it remotely.
Right. That's a good question. And really the big change that happened was that we no longer have a physical location. And so people are undergoing supervised water fasting just like they were at the house. The only difference is now, instead of me coming in and checking your blood pressure and your pulse and your temperature and asking you how you're doing, I'm doing that, but over the phone, and you're checking your own blood pressure, pulse, temperature, and all these numbers. Okay. And then also the lead-in diet, I walk you through it and coach people to do that at home. And they are still at rest. They're still following all the protocols that I've learned and that I've established, or that I've implemented in my practice and in fasting escape, still following all the protocols. But getting blood work beforehand, checking it every week, still staying completely at rest, so people aren't driving to work or driving their kids around or running errands. And then afterwards, the big difference is now I'm not making the food for people, or you're not making the food for people, or other the kitchen staff isn't making the food for people. So one of the benefits to this is that we can start anytime. So you don't have to wait for 3 or 4 months for a room to open up. And then God forbid you have something happen in your family, a pet got sick or a kid got sick or somebody, and then you have to change your room around. And now you've got, a room empty, your deposit, you can change your mind anytime. You can start this at any time. And then the other thing is, when you're done fasting, you actually get the hands-on practice of making the food. So what people have told me is that, and I didn't actually know this was going to happen, is just getting the practice when they were done with the fast, help them to sustain this afterwards. So very often people would call me up after they came from fasting escape. They said, well, I got home a week later after, 2-3 weeks of fasting, and then, a week or two of refeeding. Delicious food. It was great. I got home and it's like, now what do I do? Every so often I had patients who would ask me to train them of how to make the food. And so we do that fasting escape, show them how to chop the food and make the different soups and sauces and salad dressings and whatnot, even just basic things like how do you hold a knife properly. But now with the at-home program, people get that hands-on approach right away because they're done fasting and they've got to refeed. So it helps quite a bit, especially when the whole point of water fasting is not some miracle cure. It's to help people get back on track with a healthy diet. And long-term, the sustainable part is actually sticking on the food program as much as you can and making the food yourself. So we help people through that. Some cooking videos that I've made, I walk people through all that so they are feeling comfortable by the time they're all done with it.
Sounds fantastic. But I know me, if I'm going to do a fast, which I've done several fasts, as you know, but I would need to be in a controlled.
You got to be locked up.
Yeah, I need to be locked up. Not that I'm going to go cheat or I'm going to go binge on something. It's just, I know me, I feel better when there's people around me that are also doing it. It's like, I don't know. I just feel better.
Right. No, and the truth is that the remote fasting is not for every single person. And that's why there's options. I highly recommend, every so often I'll talk to people that are just not in a position to do a remote fast. Maybe their house is too chaotic and they don't want to get an Airbnb like many other people do. Or maybe they just like the social aspect, or they want the inpatient experience and they want the food made for them and all that. This is perfect. This is what True North is for. And this is where I come, I fully recommend True North. I still do. They're so good. But if people are actually just looking that they just need to do a water fast, they don't want any big, huge production out of it. They're just trying to get a break, or maybe they've got high blood pressure or some blood sugar autoimmune issue, and they just want to fast and can quietly work on their own health issue. Then they can do a water fast remotely.
Absolutely. Now, do you have a medical doctor on your staff?
Yes, I actually do. So last year, we welcomed Dr. Renee Thomas. Actually, earlier this year, we welcomed Dr. Renee Thomas to fast and escape. So for people who are looking for a second opinion or even just a first opinion, and they've got maybe some serious medications that they're on, or they've got a mysterious illness or some sort of medical problem that they're looking for help with, then I recommend that they book a consult with Dr. Renee Thomas. She is if she's licensed in the state that you're living in at the time of your appointment, she can prescribe or de-prescribe medications. If she's not licensed, then it's just she can offer advice from anywhere, really. So
that's fantastic. And for those of you that are watching, that are joining us live right now, if you go to the show notes, I have put Dr. Nathan Gershfeld's website, and I've also put Dr. Renee's website on there so you guys can get all that information.
And I think Dr. Thomas has actually spoke with your group before when you guys had some live talks.
Yes, she has. She's a wonderful lady. Okay, so some people may or may not be familiar with fasting. As there is the dry fast, there's water fasting. They can do a juice fast. Can you just explain a little bit about each one and maybe perhaps the benefits of each one of those, or maybe the benefits are all the same? I don't know.
Yeah. So fasting is defined as therapeutic fasting is defined as the complete abstinence of all food and drink except for pure water during complete rest. So dry fasting, some people say that they do without any drink at all. So they're not drinking any water. I don't recommend that. That's harmful for your kidneys. And we just don't see any benefit from that. There's more risks than the benefits. So I take dry fasting as a completely different thing. That's not therapeutic fasting in my book, but water only fasting and juice fasting is. And so at the truest definition, water only fasting is fasting. When we start to introduce other substances like juice or broth or maybe some steamed vegetables, that's when we call it a modified fast. Okay. The terminology is, a lot of people have interchangeable terminology, so I'm not going to nitpick on that. But what we actually have to understand is that what happens when we start to lower the calorie intake of the body is a number of things happen. Number one is we get to see weight loss. Okay. Number two, we get to see the body releases extra water. So through what's called natriuresis or extra salt. So you can notice a blood pressure drop. We also start to see insulin resistance starts to reduce. If we get to no food at all and we're just drinking plain water, these start to happen much more rapidly. So blood pressure will reduce very quickly. Blood sugar will drop down to a healthy level, and the insulin resistance will start to decrease. We also see in other animal studies that tumor markers like IGF-1 and other types of cancer growth factors will go down while water fasting. Autoimmune levels, so like inflammatory mediators, even like CRP or sed rate will go down as well. So we start to see this. Now, not everybody can do a water only fast. And so when I talk to people in their first consult with me before they were even considering doing a water fast, we'll go over what makes the most sense based on their condition. And if they're on medications, for example, but they need to do a water fast right away, we might do a modified fast rather than a water only fast. But yeah, there's different types of fasting out there, but for the most part, it's when you reduce calories, and then water fasting is when you reduce it down to zero and just drink only water.
Oh yeah, been there, done that. Mm-hmm. Not very pleasant. That's why I think misery loves company, and being in an environment where everybody else is doing it with you, you can all commiserate and talk and get through it together. Is fasting easier for someone? The water fast, is it easier for someone who's been following a whole food plant-based diet as opposed to someone who's been following the SAD diet, the standard American diet? What have you noticed any differences?
Yeah, what you do before the fast makes a big difference as far as how miserable the fast can get. The fasting can be intense, it can be miserable. There can be any number of withdrawal or what we call detoxification symptoms like headaches and nausea, these types of things. But what, when I work with people, we make sure that for at least a couple of days before the fast that they're eating very, very clean. Okay. So if it means phasing down from caffeine, sometimes that's difficult. So we do that when we're fasting, if that's not possible, but phasing down from caffeine, phasing down from animal products, high fatty foods, refined foods, the less of those, the better. And the cleaner people do, the better people do before the fast, the easier the fast can be. That said, is sometimes the fast is just miserable. You're kind of hitting your body all at once as it's eliminating many things. In particular, if someone's lived a very toxic lifestyle, or if they've lived a lifestyle that had a lot of rich foods, then they can run into some trouble. But for the most part, This is why we're checking blood numbers, make sure that the kidney functions is normal, the electrolytes are normal, the vital signs are normal. And if those are normal, then we say, okay, you just have to suffer through it. And it typically goes away very soon.
Okay, so you touched a little bit about prepping before a fast. So what does that look like? Are you prepping? Is it certain foods you're eating? Are you prepping for like a day, 2 days, 3 days, a week? Or what does that look like for someone?
Yeah, we try to do a couple of days at least before the fast goes. And it's just fruits and vegetables, sometimes some starches, depending on the person. It's kind of individual because some people may have some gut issues. That's why they're fasting. And so we might do a little different lead-in diet. Someone, I'm working with a couple of people who just were doing their best and they just got into some junk food leading up to the fast. And so we started fresh and just got some, veggie soups and stews. Okay. So that can be really useful. But yeah, this is, one of the things is we want to make it highly individualized. Luckily, I don't have to make soup for 4 or 5 or 6 people, and everybody has to eat the same soup. And so that means that we can individualize the lead-in diet for everybody.
Sure.
So some people may not like zucchini, for example, or carrots or whatever it is, or they like them really well steamed versus really raw or whatever it is. And so we make it we just walk you through what's going to make some sense, and then you get to make it however you'd like.
I remember every time I went up to True North before my fast, I would do a fruit and vegetable like a week before. And for me, that seemed to really, it helped. Yeah. It helped for me to do that. So it felt great. Not that, and I eat pretty clean, as you know, but for the week before, I used to do just all fruits and vegetables. And that worked for me.
That's exactly the thing to do. And so, yeah, that makes the fast a little bit easier.
Yep, that's true. Well, it's still miserable, but it makes it, you're right.
It's a little bit easier. Yeah. Yeah. At some level. Yeah. In principle, if you were really, really, cleaned and there was not a lot going on, then you might just be tired and weak during the fast. But the truth is that nobody's really perfect. Everybody's got a little bit stuff going on. You might have some, even just breathing polluted air can be enough to get you tired. So we do the best we can to make the fast as miserable as possible. But I also try to.
Did you just say we make it as miserable as possible?
As little misery as possible. My mistake.
Oh, okay. That was funny. So
yeah, it's good.
Since there is a protocol before fasting, starting your fast, I'm sure there's a protocol after your fasting. Now, do you make that individualized, or is that basically the same for everyone?
There's some principles, but it is individualized because, like I said, some people, their guts don't really handle raw fruits and vegetables all that well. And some people prefer more steamed vegetables. Right. But we don't want to jump right into, bean burrito with avocado and vegan sour cream. Okay. Right after a 30-day fast or a 21-day fast. So we want to be real careful doing that. Like I just had a couple of people who did long fasts, a 4 week water fast. And we had to be very careful, make sure that they can get their Instacart and have somebody deliver the food for them and they can get some juice. And we actually very slowly step into solid food, then cooked food, and then go from there and make sure that they exit the fast properly.
So what's people's reaction with that first? Because I know the first meal I had, which was zucchini, I thought that was just, oh my God, it was over the moon. It was the best thing that I have ever tasted. So what's some of the reactions that people have had that you can share with us about their first meal?
It's exactly what you just described. Yeah. So what happens during fasting is your taste buds get much more sensitive. And so what a watermelon may have tasted, pretty good before a fast, but when you haven't eaten for 3, 4, 5 days, or even 2, 3, or 4 weeks, it's like then what we see is that the taste buds are incredibly sensitive, and the fruit juice or just the plain fruit tastes really good. It's sometimes the best meal that they've had. Well, it is the best meal they've had.
It is the best meal. It is the best meal. I just remember there's one juice that they were giving us I think it was celery and watermelon. Mm-hmm. And I ended up taking a sip of that, and I ended up sending it back. I told Mauricio, I said, "You've added way too much sugar to this." He goes, "Shayda, it's just watermelon and celery." I'm like, "I can't drink it." So he had to go and bring me back a green juice. So you're absolutely right.
Yeah.
Absolutely right. Is it safe for someone to do fasting on their own without your help, without any kind of medical supervision, just completely on their own?
Well, it's what we want to talk about is some of the risks. So the longer that you go, the more risky it is. So I just don't generally recommend that people try or attempt a long fast on their own. And it's for the reasons that we don't know what's actually happening in the body unless we find out. And getting regular blood work done, so getting a baseline blood work done, getting it every 7 days, that's something you want to know. And then getting your vital signs and interpreting them, that's something you want to know if you're going to do a long fast. And so if there's something going on, you'd rather know that there's something going on, like maybe the blood sugar is rising or the blood pressure is dropping too fast, or maybe there's something going on. We don't know unless we actually take the data. And so if you do that on your own, like if I've done a fast on my own and I did that, took those numbers, fine. But if you don't take those numbers, you're kind of flying blind. So if something does feel off, you're not sure if you're actually detoxing, and that's normal and you should suffer through it, or if it's a sign that you should break the fast, and or maybe you're not drinking enough water, or you need some juice or whatever it is. So typically the recommended longest fast that people should do without any of this monitoring is somewhere between 3 to 5 days. But that said, if you're on medications, I don't recommend that anybody does a water fast while they're on certain medications, other than say like hormones like thyroid or other things. But if you're on other medications like psychiatric medications or high blood pressure medications or diabetes medications, then there's a couple of things that happen. One is medications actually, the toxicity of these medications and even the effect of the medications is magnified while you're fasting. And so if you're taking blood pressure medications, you start water fasting, not only can it be toxic to your liver and kidneys, but it can also more rapidly drop your blood pressure. And so you can pass out and hurt yourself. And so this is, if somebody's on medications, I don't recommend that you do any water fasting unless you talk to Dr. Thomas, and then she can come up with a good phase down or wean down schedule, or talk to your doctor, to your local doctor, and they can do that as well. So most doctors are supportive of this. If they're not, then people will actually seek help with Dr. Thomas, and she'll walk them through the process. And so yeah, there's a few considerations here, but for the most part, fasting is safe. If we do it properly, fasting is safe. It's just that the longer fasts are going to be a little bit more risky. So we want to make sure we evaluate people to make sure they can handle a fast without exposing themselves to unnecessary risk.
That makes total sense. Who benefits the most from fasting? What types of people, or what kind of conditions?
Yeah. So in general, the biggest benefit that we see are people who are suffering from conditions of dietary excess. So if you've somehow had some sort of chronic condition or even acute condition that's due to overconsumption of the modern Western diet, then fasting will benefit you. So specifically, I'm talking about things like high blood pressure. Okay. High blood pressure, type 2 diabetes, autoimmune conditions, things like being overweight or obese, just getting off track with your diet, extreme tiredness, even detoxing or withdrawing from certain medications. Some sort of modified fast can help. I'm working with a number of people in the last few weeks where they were either getting off of medications or they're attempting to get off medications. And so we're working with them doing a modified fast of some sort of juice or soup or veggie soup, or essentially some sort of healthy diet to help the body work better. So we're not really going to see a lot of benefit for people who have some sort of genetic anomaly that's causing a problem. And we're not going to see benefit from people like type 1 diabetes. We don't do fasting with type 1 diabetes. Someone with chronic kidney disease may benefit from a modified diet. Okay, so maybe some low protein soups and whatnot, but water fasting may be too intense if the kidney function is impaired. But people with these types of conditions, they oftentimes may seek dietary help, but not necessarily water fasting.
Okay, so my next question was going to be, who should stay away from fasting? So I'm guessing type 1 diabetes and people with kidney failures.
Mm-hmm. Yeah, and there's people who are pregnant, for example, or breastfeeding. We don't do water fasting with that. It does dry up the milk, and also we don't understand quite fully how fasting ketosis will play a role in pregnancy and how it affects the baby. So we stay away from that.
Okay. In order to get the most benefit, how long does a person fast? Because I once asked Dr. Goldhamer, well, how long do I need to fast to, shrink the nodules on my thyroid? And he's like, well, as long as it takes. And I'm like, right. Well, how long is that? He goes, As long as it takes.
We don't know.
We don't know.
That's true. We don't actually know. Everybody's different. So I did a 5-day fast and shrunk my nodule by 80%. But other people might take 2 or 3 weeks and it may, mine didn't even go away. You know what I mean? So it could have taken 2 or 3 weeks. Other people take a little bit shorter, a little bit longer. The truth is that we don't actually know. It's all individual. And so when I do the complimentary consult with everybody before they start the fast, we discuss that and we kind of get an estimate. The good news is it's kind of open-ended. So if people have the time, we can do the fast. We don't have to wait for a room to open up and anything like that. So we can change our minds anytime.
I think that's good. Well, you touched on people. What kind of benefits do you see with type 2 diabetes?
Well, type 2 diabetes, what diabetes is the improperly controlled blood sugar. And in type 2 diabetes, the reason why it's improperly controlled is that the insulin, whose job it is to bring the glucose from the blood vessels into the cells are actually clogged with fat. So the insulin actually can't get in. And so the blood sugar continues to rise, the pancreas continues to work and produce insulin, and now we have a problem. So with someone who is a type 2 diabetic, the real problem or the real concern is to actually improve the insulin resistance. And so we can do that with both eating the healthy diet and doing the water fast. So to sustain the healthy diet, we have to make sure that the taste buds are nice and sensitive. And so we do that with a 1-2 punch, do the diet ahead of time, do the fasting, and then go back on the diet afterwards. And type 2 diabetics do phenomenal after this.
Would you at any time consider doing fasting someone that's on insulin, or is that a complete no? No,
that's a contraindication. Yeah. Okay. Yeah. You can modify a diet. So if somebody is on insulin and they are struggling with the pleasure trap, meaning they are eating unhealthy foods. They're in a negative cycle. They're in a vicious cycle of just eating unhealthy foods every day. Then we could actually just walk them through a 3-day cleanse. And I say cleanse loosely because your body's always cleansing itself, but we could do something, what I call break the cycle. Okay. Sometimes you just need to get an Airbnb somewhere for 3 or 4 days and just bring your Instant Pot, bring, Shayda's cooking channel with you, and just make a bunch of recipes for yourself for 3 straight days. Okay. And you get back home after your little vacation and all of a sudden you're back on track. Okay. So that's what we recommend for people who are on medications that maybe can't get off of them so quickly. And what we work with people on is if maybe they don't want to do that and go away, I actually watched a number of people in their 2 days leading up to the diet, up to the fast. That's what they're doing. They're cleaning up their own house so that they are relaxed and they don't have the closet that's been, full of stuff for 10 years, wearing at their mind before they're starting to fast. So.
Yeah, I get. Can you talk a little bit about fasting in regards to cancer? What if someone has bone cancer? Can water fasting be beneficial?
I think it can be beneficial. It depends on the kind of cancer. So lymphoma appears to respond the best. I've just seen it respond very well to cancer. And we've had pre-MRIs, post-MRIs or scans. True North has published a case study on that as well. What fasting can do is decrease certain tumor markers, at least shown in animals, non-human animals in different studies. And it also can help people get back on the diet that they need to not eat the foods that are causing cancer, like processed meats and things like that. Another big cause of cancer is going to be smoking. Okay. And it's very difficult to get off of cigarettes in the modern world and just in general. And so I've worked with a couple of people who were smokers. They didn't have cancer, but they were smokers, and they saw that later on down the line they'd have trouble, and they were trying to get off of cigarettes, and they were dealing with other issues. And fasting can very, very easily help people get off of the cigarettes and stay off the cigarettes. So sometimes you have to get locked up, like you said, go to True North and get locked up. Yeah. But sometimes I've worked with people who are able to do that at home and just walking through, throwing everything away and just starting the fast, and they feel quite miserable to the point where they don't want to do the cigarettes anymore, and then they just go longer away from them. So it's very difficult, but yeah, certain cancers can respond well to fasting. If people are deciding to do chemotherapy, there is some data suggesting that doing fasting before chemotherapy can make the chemotherapy more effective. I've worked with a few people that were doing surgery for their cancer, for say like colorectal cancer, and they'll either do surgery and then the fast after they recover, or they do fasting and then the surgery as well. So there's a number of options. We're just helping the body get healthier, regardless of what you choose to do.
That's wonderful. Now, would you recommend, and I know what your answer is going to be, fasting for weight loss? I mean, because some people might want to get a quick fix, like, the quick way of losing weight, but if they don't maintain what they're doing afterwards, it's all going to come back.
Yeah, you're so right. I think, I do work with people who are trying to lose weight, but I try to impress upon them that we're not trying to quickly lose the weight and then be done with it. As you know, Shayda, with your story, this is a long-term thing.
Oh, absolutely.
And what we're trying to do with fasting with regards to weight loss is actually solve a particular issue that comes up with anybody, but in particular, when you're overeating, is you're getting caught in the pleasure trap. And the foods that you're supposed to eat, if you're not eating too much of them, and you're eating the other stuff, the foods that you're supposed to eat don't taste all that good. And it can taste really bland. And so if you're supposed to eat the fruits and vegetables and the steamed veggies and the starches plain, then it can be two or 3 weeks sometimes for them to taste good. But if you do a fast, all of a sudden now you do a 1 or 2 week fast and they taste really, really good, like we talked about earlier with the juice and the fruits afterwards. So it can help people break that cycle and get that momentum back.
For those,
but it's difficult.
For some people that are watching that may not be familiar with the word pleasure trap, can you talk a little bit about that?
The pleasure trap is the hidden force that's undermining health and happiness. And I say this because it's the title of a book of two of my mentors, Dr. Doug Lisle and Dr. Goldhamer. So what the pleasure trap is, it's a trap that happens in the human mind when we are exposed to chemicals that hyperstimulate the dopamine pathways in our brain. So if you are smoking cigarettes, for example, the reason why your brain craves this extra dopamine is because it's designed by nature to do things that result in a dopamine hit. And these things are seeking food. It could be sexual reproduction, so dating and mating. But when we start to invent or discover chemicals in our modern environment that hyperstimulate this pathway, then we run the risk of getting addicted. So this happens in alcohol. This happens in drugs. So I was given a talk at the Fasting Escape, and I had a police officer who was staying with us, and I gave a talk, and I explained that if someone does, say for example, cocaine, they get about 8 to 10 times the amount of dopamine hit than an orgasm through sex.
Oh, wow.
Okay. And so the first question from some people, I was like, well, where can I get the cocaine? But the truth is that he came up to me afterwards and he said, I've been a police officer for, I think it was 15, 20 years, something like that. He was getting ready to retire. And he said, I never actually understood that this was driving a drug addict's behavior. I always would come up with these people down the street and say, gosh, just got to get your life together. You got to just make a choice and make a decision. And he realizes there is no choice.
Right.
Okay. How do you compete with 8 to 10 times that of pleasure of that from sex? Okay. And so what we have is, luckily food does not give us that big of a rush. But it gives us enough of a rush that it can get us caught in a trap where we might be thinking and feeling like this is what life is all about, and we'd rather die sooner if we can't have this food, and that we don't really want to disrupt our life too much because it's just not worth it. In the meantime, we're getting sicker and sicker and miserable and achy and pains, and life is not good. Okay. And so this is going to be a theme and this is why Fasting Escape is called the Fasting Escape, is that you're escaping the pleasure trap. Okay. And so this is going to be a theme in a lot of health and wellness programs, is that we're actually trying to get you back on track and away from the foods that are causing you to be in these addictive tendencies.
And for those of you that have not read The Pleasure Trap, I highly recommend that you read it. It's not, honestly, I've read it like 3 or 4 times because it's not an easy book to read right off the bat. But it is absolutely fascinating, and it really can change your life. Like, it's fantastic. So, all right. Well, if someone is suffering from severe migraines, how can fasting help, or would it help?
Well, it's going to depend again. So a number of these kind of specific conditions are going to depend on other factors. And in particular, if someone is experiencing migraines, we're going to want to know some of their history, caffeine intake, medication intake. If they've had some neck trauma, for example. Sometimes neck adjustments to particular areas of the neck can help a little bit. It's going to really depend on what they're dealing with. But I've worked with a number of people who suffer from migraines. Sometimes it's as simple fix as adjusting their diet. Sometimes it's adjusting their diet and recommending that they see a particular type of chiropractor who might be able to work on their neck. But the idea is we're trying to actually get the body as healthy as possible. And if we do that, it can recover from a number of conditions, including things like migraines.
That's fantastic. And I'm guessing your answer is going to be yes to this next question. Does fasting help with the LDL cholesterol? I'm guessing it does.
Actually, fasting will cause cholesterol to go up temporarily.
Oh, really?
Yeah. So cholesterol will go up a little bit. So that's why I've had people who will they have their life insurance appointment, and so they know that they've been drinking too much alcohol and they've been eating too much rich food. So they know their blood sugar is up, but their liver enzymes are up, and they want to get a lock in a good deal for the life insurance. And so they want to take their exam right after they're done fasting, and I have to tell them, you want to wait at least a few weeks, because when you fast, the cholesterol gets released into the bloodstream, and so it can go up a little bit. And so, but that's temporary. So it does come down as you continue to eat the healthy diet, but we know that temporarily it does elevate the LDL cholesterol.
Oh, I had no idea. Good to know. And the benefits, and once somebody has fasted, how long do the benefits of fasting last? And I'm guessing it's as long as you maintain a healthy diet.
Right. Absolutely. So it's not an all or nothing thing. You don't have to be 100% perfect for the benefits. Although we can agree that in principle, the more compliant you are, the longer that you are, the better the benefits. But everybody's a little bit different as far as what they can get away with. And so, yeah, the fasting benefits is that you're giving your body a break. So imagine a big machine that, like a big factory that needs a maintenance and some tune up every so often. If you clean it out and give your body a chance to maintain the machines and oil things and kind of clean out some of the gunk, then it's going to be much better at handling the normal things that you typically handle once you're done fasting. And it can sustain the changes quite a long time.
Very good. I think we have questions, and I'm going to have Aaron read the questions to you.
Okay.
So, go ahead, Aaron.
All right. So who can benefit from fasting more than 3 days?
If the person's live, I'm actually trying to find out what they're asking. Is this kind of a general question? Who can benefit from 3 days? It's going to depending on there's a lot of benefit that can be had with a greater than 3 day water only fast. It's just going to depend on what their goals are, what their outcomes are looking for.
You messaged them, right? So hopefully
yeah. So you can, if you want to add to that, it was Kathy.
Mm-hmm.
I'm sorry, it wasn't Kathy. I'm sorry, it was Karen.
Yeah. In general, if we're going to do a longer than 3 day water only fast, we're going to want to get some 3 to 5 days longer than that. We're going to want to get some blood work done, and we want to start taking vital signs every day. Okay. And I work with people to set all that up and make sure that they can find a place where they can get some blood work done in their area. But if people are, say, caught in the pleasure trap and they need a short, 3 to 5 day or a 5 to 7 day water fast, this can benefit quite a bit. If someone's got a more chronic condition, then usually a longer fast may be of more benefit. What's usually the limiting factor for the length of fast is how much time people can take off of their life. Okay. Not off of their living years. I'm talking off of life, their work and their running errands and keeping their house in array and whatnot, whatever it is. So sometimes if that's not possible, then people will actually book an Airbnb somewhere or someplace with a kitchen so that they can just get away from it all, let the family deal with whatever's going on in the house, and then they can come back fresh and new.
But you will do a consultation with them, and then and talking to them and all that, then you'll determine what is the best course and for how long, correct?
Right. So there's two things that I offer. I do complimentary consults for everybody before they start doing the remote fast with me. And then every so often I have people who reach out to me and they're in the middle of their own fast. And because that's not, we're kind of flying blind at that point, but I offer consultations for people who just need some help refeeding, or they've got some questions about fasting in general. And those are just, consults, paid consults that people can book on the website.
Very good. Erin, what's our next question?
So, what were the effects of your autoimmunity? Did you find certain foods triggered it?
Oh yeah.
Okay.
Yeah. I've got to stay away from wheat products, so gluten products. And I'm vegan, so I don't do dairy, but dairy, animal products, things like that.
So was it primarily food, or was it stress or environment?
No, it was food, primarily food. I mean, I don't actually know what could be environmental factors. I was doing electrical engineering where we do, we solder things. So we're exposed to some toxic chemicals when you're doing that. And I'm sure that probably played a role, but I'm not actually sure. It's unclear. But in general, yeah, I try to stay away from toxic substances nowadays. So.
All right. So if intermittent fasting, what effects does eating a higher caloric food during your window of eating do?
Actually, can you say that question again, please, Erin?
Yeah. So when you're intermittent fasting, if I can say it, what effects does eating a higher caloric food during your window of feeding do?
I'm not actually sure that would make any difference. Okay. So let me just, this is a multiple part question. So let me explain what intermittent fasting is to the listeners.
Thank you.
Intermittent fasting is when people voluntarily restrict the time that they eat. Okay. So, and there's a number of different, ways that people do this. Okay. They might say, well, I don't eat early in the morning. I only eat from, say, 12 to 6 p.m. Okay. Or they might say, I only eat from, 4 to 8 p.m. or whatever the window is, or I only eat once a day. Okay. So I eat breakfast and then I don't eat the rest of the day until the next day. Okay. So this is kind of the differences in different fasting. Intermittent fasting is when you do that. Okay. Now the next question is what is the effect that the body has when you eat a high calorie dense food during this window? And the truth is that there's nothing different that happens when you eat a high calorie meal during this window than if you weren't intermittent fasting. Okay. So I don't recommend that people are engaging in a lot of intermittent fasting. The reason for that is there's going to be some people that are doing fine and they can actually stick it out and grit it out and not eat for 4 hours or 16 hours at a time or whatever the window is. Okay. However, that's not most people. Most people, the way your physiology works, okay, for everybody, is that you need to be feeling full and satiated and not restricting the windows when you're feeling hungry. And you don't want to be actually overriding your hunger drive. Because if you do that, and I talk to people all the time who tell me that they did intermittent fasting and then a few days later, a few weeks later, now it's 10 p.m. at night and they can't take it anymore and they get into a bunch of junk food. Okay. So I think that I recommend that people, if this is what happens when you do intermittent fasting, then throw that out. You don't need to restrict your meals every day. You want to be eating whole foods, lots of food, starches, cooked vegetables, raw vegetables, fruits, all these healthy foods, several times a day. Okay. So that by the time you're going to bed, you're full and you're fine. Okay. And so that's this question is kind of based on I'm not really sure what the person's asking, because there isn't really any difference between eating a high calorie dense meal. That's not going to ruin your intermittent fast or not. It's just going to, your body's going to, want certain calories throughout the day.
But you wouldn't want an intermittent fast and then go and eat something like a piece of cake during your window.
Yeah, you wouldn't want to eat a piece of cake anyway.
Exactly.
Yeah, maybe I'm actually thinking that the question could be, what happens if you're fasting and then you eat a high calorie meal right away? And this may, if I'm maybe I just misunderstood the question. It could actually be, what if you did a long fast, say like 10 or 15 days or 21 days, and then you ate a high calorie dense meal right after to refeed? That's a separate question. And then we get into what's called refeeding syndrome. So when we look at the space inside the cell and then the space in between the cells, when you start fasting and you're starting to lose a little bit of fluid, which happens typically because the compartments get smaller, When you stop the fast, you have to gradually reintroduce foods because if you do it too quickly, then the body will actually increase the size of the compartments and it'll infuse kind of through osmosis the electrolytes into the cell. And if that happens too rapidly, then you can have a fatal shift of electrolytes. Okay. And that will cause some arrhythmias and strokes, things like that. So you don't want to have very concentrated meals like a cake or burger or IHOP or whatever it is right after a very long fast. Yeah, I know. And so, that may be, could be what the person's actually asking. But as far as intermittent fasting, there's no risk of refeeding syndrome when you're doing the intermittent fast because those are usually not longer than 24 hours.
That makes sense.
And I think you've kind of answered this, but what is very clean eating?
Oh, yeah, we have clean eating. We have so many diets out these days. I'm actually specifically talking about whole plant foods. So example could be oatmeal and fruits for breakfast, could be a salad, cooked veggie soup with potatoes or baked potato or some sort of bean soup or lentils or a rice dish. And that's going to be similar for dinner. What we don't want is we don't want to be adding a whole bunch of oils and fats and like overt fats like butter and ghee. We don't want to be adding a whole bunch of salt and soy sauce and amino acids and all these other things that people will add to their foods. And we don't want to be adding a lot of extra sweeteners and sugars and things like that. So that's what I mean by clean. We certainly don't want to fry foods and we certainly don't want to be adding large amounts of animal foods either.
Perfect. Can someone with low kidney function do long-term water fasting?
At the very first pass, I would say I wouldn't recommend it. However, if they're actually in that space, then I'd encourage them to reach out to me and book a complimentary consult with me on my website, and we can actually discuss what it is that we can do if they're trying to improve their kidney function. I'd want to see their blood test, their creatinine and their glomerular filtration rate, their electrolyte levels, and then what kind of diet they're on currently, and if they're on any medications. And then we could co-manage that with Dr. Thomas or their medical doctor and see what the best strategy is. Sometimes fasting may not be recommended, but we can certainly do a healthier diet. And I've seen a couple of people recover from some chronic kidney disease with the right strategy.
That makes sense.
Would someone with metastatic thyroid cancer benefit from water fast?
I don't know. It would depend on what kind. So papillary thyroid cancer is the most common, and thyroid cancer is so low risk that it typically it's going to be rare for me to see somebody with thyroid cancer because it's so low risk and it's such a simple procedure. They simply just cut it out and that's it. That most people are not going to be scared and trying to seek other options. However, if someone strongly wants to avoid the conventional treatment, that's something that I talk to them about and see. It could be that the research shows it's actually worth it for them to do the surgery, especially if it's metastasized. However, we do know that fasting does reduce certain tumor markers and does reduce potential growth. And so it may make sense to either do it by itself or do some sort of combination of fasting and maybe some conventional treatment as well. So it's going to depend on the person, and I'd encourage them to reach out to me. We can discuss what makes the most sense in their specific situation.
Very good. Any other questions?
Yeah, and this is going back to the benefits of fasting for over 3 days. So they added their whole food plant-based, recovered type 2 diabetic. I have reached my weight loss goal and maintained for 20 months.
Fantastic.
I do have chronic kidney disease, but it has been stable since going whole food plant-based. And then they added my latest kidney function was up to 55.
To 55. Oh, so the GFR is at 55. So that's good. GFR is supposed to be above 60. And so I believe if that's what they said, then that's great. In that case, if you are recovered from the kidney disease and diabetes, maybe a 3-day fast, we would want to actually get some updated blood work to see. But my attitude is if you're on the right track and everything's going fine, you just don't need to do a water fast if you're in that position. Okay. Where people will actually do a water fast if they're in your position, but maybe they fell off track. Okay. And they've broken the cycle. They're kind of, they're off track. They're eating some, Beyond Burgers or whatever it is. And they just or they're adding a bunch of salt and oil to their food and they just can't get back on track. And then maybe a 3-day or 2-day break can do a good thing. But if you're already on track and you're doing good stuff, I don't really, and I wouldn't really mess too much with stressing your kidneys out if you've had a history of that. Unless you've got a particular reason for it. So in this case, if you really strongly wanted to try water fast, reach out to me. We could see what works and what fits depending on your blood work. I couldn't tell if you said it got to 55 or it's 255. There would be different answers there. So
it was 55. Sorry.
It was 55.
it's 55. Okay. So yeah, if you got your GFR up to 55, really well done. That is huge. Okay. And so I'd say stick with the food as best you can. And if you start to stumble, then may make sense to do a 1 or 2 day or 3-day water only fast if you need to. Okay. But get updated blood work before you start that.
Yeah. But if somebody was having kidney or had some problems with their kidneys, could they still do like a juice fast?
They might. It depends. It is going to depend on what their creatinine and GFR levels look like, what their ultimate goals are, if they're on medications, how far gone they are with their chronic kidney disease. In general, the reason why we don't recommend a lot of fasting for people with kidney problems is because fasting can be stressful to the kidneys. You're essentially detoxing much more rapidly. The kidneys are working hard. So if they're already damaged, then they're going to be working harder. And so we run the risk of doing that. Now, I've done some fasting with people with only had one kidney and they did just fine. But it just depends. There's such individualized recommendations. And we want to make sure that they're definitely not exercising and stressing their kidneys out even more. They're drinking more water, and that there's nothing else going on in their health history that would suggest that it'd be very risky. So I choose only the safest patients to do, safest candidates to do remote fasting because you're at home. So, if anything starts to look weird, then you're going to make yourself a juice. You call me, at night or whatever, you make yourself a juice. Or, we luckily, I've been doing it now for a few years. Nobody's had to go to the hospital. Okay.
Thank God.
Everybody's but it's because we push really hard to make sure that only the safest situations could do the fast. So I know that that's always a concern with any type of fasting, but in particular remote fasting as well.
So I don't believe we have any more questions you do have a question from the
just
audience.
popped
Okay.
My EGFR started at 31 when I began my whole plant-based journey.
Yeah, that's huge. That's huge. That's a GFR of 31. So for people listening, if it's supposed to be over 60, okay, and so that's huge that it got down to that it was at 31 and got now up to 55. So really well done. You should be very proud.
I think we should give her an applause for that. That's fantastic.
All right, no more questions.
No more questions. So Nathan, if someone is interested in contacting you and doing a fast, how should they go about it?
You can go to www.fastingescape.com and read through the program, make sure it's right for you. It's got all the details on there. And there's also a link there that you can click on Get Started, and you can click and schedule a complimentary phone consultation with me. And then we'll discuss your particular issue. You'll get an intake form by email. We'll discuss your particular issue and then see what makes the most sense when you want to get started. And then you'll get all the information about how to do that.
So do you fast yourself?
I do. Yeah.
Often?
I'm not perfect. I get off track every so often. And so I'll do a fast, 3 to 5 days here and there at a time once a year is kind of what feels right to me.
Oh, that's fantastic.
We have one more question. Do we have time for that?
Yeah, of course we can.
Yeah.
So for detox, so I've heard we can think we're detoxing, but we're actually reabsorbing toxins. What do you think about, or what do you recommend to prevent reabsorbing toxins?
I don't actually think we're reabsorbing toxins. I think most toxins are coming out. You're always detoxifying, first of all. And so whether you're eating terribly or not, and most of these toxins are coming out from your urine. So your kidneys are filtering out these things and going out to your urine. And so I think in the context of reabsorbing toxins, most people think they're reabsorbing toxins if they haven't cleaned their bowels before a fast, and so they need to do an enema so that they don't reabsorb toxins. And I don't think that's the case. That would be a mistaken assumption there. So your body's pretty good at removing toxins. If you've got exposed to some toxic heavy metals or something like PCBs and other things, then fasting even can help that. Researchers have found, I think it was a Journal of Industrial Medicine in 1984 in Tokyo, where workers were poisoned by PCBs, of polychlorobiphenyls. and they did a fast, and they found that the elevations in their blood, the concentrations of the PCBs actually went up in their blood, which means it was getting pulled away from their tissues, getting into their blood, and then filtering it out through the kidneys and urinating it out. So yeah, a lot of little biochemical pathways that happen, but your body is really good at cleaning things out for its own benefit.
Do you foresee at anywhere down the near future that perhaps you might end up opening up a retreat down here?
Oh, we'll see. We'll see how it goes. For now, for people, until then, we'll keep doing the remote fasting with people who need to do a fast and just want to do it from their own home.
I'm being selfish. I would love for you to be down here and have the fasting escape right here by my house. So that's why I want that. So
Yeah.
That's why. Well, if we don't have any more, do we have any more questions, Sarah?
I don't think we do.
And do you also want to talk about your podcast?
Oh, a podcast, just a side project with Dr. Lyle.
That is a great podcast.
Yeah. We just, Dr. Lyle really, him and Dr. Hawk talk about different psychological concepts. So it's, we don't really talk about diet and lifestyle there because it's a small part of the whole picture. But for people who are interested, it's called Beat Your Genes.
Beat Your Genes. Well, who came up with that name?
Well, it was Dr. Lyle's concept called Beat the Genes, and I just said to beat your genes. So, yeah.
That's fantastic. Well, I can't thank you enough for being here with us tonight. This has been absolutely fascinating, and it's been absolutely wonderful. So thank you so much, Dr. Gershfeld, for being here with us tonight.
Thank you so much, Aaron and Shayda. Really appreciate you guys having me on. And thanks you everybody for the great questions. If you have any questions, if you more questions, you can send me an email or just schedule a complimentary consult if you're thinking of doing a remote fast and you're wondering if it's right for you.
Thank you everyone for watching another episode of Healthy Cooking with Shayda. As I always say, it's one bite at a time, one meal at a time. And until we'll see you soon. Have a good night, everyone. Bye-bye.
All right, we're done.
We're done. Is Nathan still